Hey guys, it's Dr. Emer. We're out of the OR, back into the clinic, and we're doing one of my favorite treatments. We just did in the operating room surgical buttock augmentation. Now we're doing non-surgical buttock augmentation with Sculptra injections. This is to give my patient, he's already super muscular and has a nice perky butt. We're just gonna give him a little more lift. It's a little hard for some guys who are really lean and athletic to have like as much perkiness as they might want because they don't have a lot of fat. So unless they do a lipo and try and get the fat, we don't have it. So somebody that works out a lot can do Sculptra, which is little crystals, you can see them inside the fluid, and it's made of a particle that's actually a suture material. And the suture material then builds over time. It takes sometimes 3 to 6 months to fully see, but most people notice it in about 4 to 6 weeks. I tell people to do the first 2 treatments a little closer together at about 4 to 6 weeks, usually 3 to 6 weeks, and then the next couple treatments after that you can space out. You can go to 6 to 8 weeks, then 8 to 12 weeks, and then you can kind of do it as maintenance depending on the size you want. If you want more, you can keep going. My goal for him right now is to give him more of this upper portion. So you see how on this side we now lifted it here in the upper pole. Take a look at the upper pole of the buttock. The thing is, if you do too little, you just won't see a result. Meaning that there's collagen in there that's working. So we're getting a really good improvement. But we're just going to keep doing that. And you could add even Bellafill or something called Renuva, which is a synthetic fat injection as well, or you just do a traditional BBL. Someone like him that's already has a nice butt, I wouldn't do an implant. I don't think he needs it, but if he really wanted it, you could. It'd just be huge, even a small one. But this is, I think, great when somebody's already working out because this will enhance what they're working out. Any questions on there?
No, just I want, wow.
I know. This is honestly, I keep saying to myself, I need to do this too. Because it builds collagen and it just goes along with your working out. These particles will build with exercise over time. So it's just a part of my athletic male and females body shaping programs, you know? Mm-hmm. I think it's great, and you can already see like now we have the fluid here. That's where it's going to really help build, and then we just keep going.
How much does this cost to be done?
What'd you say? Well, yeah, and on average, vials range between $800 to $1,000, so it is kind of expensive. You know, if you needed, let's say, 20, 30, 40 vials in the year, it could be very expensive. Whereas BBL might be $10,000, $20,000 permanently. So you kind of have to weigh your options there, or an implant. Implant's the cheapest of all. But again, every time you do something non-invasive, it's easier for you, but again, it's going to be more expensive. But this is, again, I think part of an active lifestyle. You do 2 or 3 close together, and then you just do every quarter a small amount, and you keep doing this with your working out. You could have an amazing butt. In girls, you can improve cellulite and indentations. In men, it can give some size, it can give some perkiness. Squeeze as hard as you can. Perfect. I just want to see the roundness. You guys can see there. Good, relax. We're going to keep building a little bit in this upper portion here. And that's it. And then we're going to keep going and wait a few months and see how it builds with this working out. So that is Sculptra non-surgical buttock augmentation.
How long does it last?
Well, it will last 2 to 3 years. So I always tell people, do your treatments, but then maintain it. So you don't have to worry about lasting because it's going to build over time. And it'll be preventative as well. All right, so hit end, save, make sure we hit